A very good afternoon, everybody. Welcome here. A warm welcome to you all. We extend it from Apollo family here. And I welcome everybody today to this World Cancer Day celebration. And may I now call our director, who is Chief Executive Officer, Apollo Cancer Hospitals. In this event, I'm sure it is going to be a very relishable and cherishable moment for all our survivors who are going to be inspired by your presence here. While moving ahead in the program, I would request our senior consultant, Dr. TPS Bandari Garu, senior consultant surgical oncologist, to be here to speak about, to address the cancer survivors here regarding not to shy away from speaking regarding cancer.
A very good morning to all of you. This is Dr. Reddy. Before Dr. Bandari speaks anything, it's my humble duty to welcome the dignitaries on the dais. At the outset, I would love to welcome. It's an honor and pleasure to have you here, Siddhar Babu Garu. It's most dynamic, young, I can call you handsome young man, and a long career to go forward. And he is from Hyderabad, from Nizam's College graduate, and is a great cricketer too. He represented Hyderabad in the cricket, and joined politics after his great father left politics. Or you're sorry to know that, sir. But it's good for the state of Telangana that he has taken up politics and is a man of people. Is doing a wonderful job for the state, and we are very happy for you being the IT Minister, sir. You're welcome, sir. And it's my humble duty to welcome our dear Executive Director, Ms. Sangeeta Reddy Garu, the torchbearer of Apollo Group of Hyderabad, most loved and respected Apollo in the Apollo family. Welcome, madam. Welcome to you. And I welcome my dear patients, press, and staff of Apollo and my team members for this occasion. And you all know that today is World Cancer Day, and what we need to talk is all about cancer awareness, and we keep doing such small programs. Most important thing I would like to mention, you heard about Dr. Shanta, the chief of Adyar Cancer Institute, Padma Bhushan awardee. Once she was addressing, she said, "I'm not worried of cancer, but I'm worried about the late diagnosis of cancer." So that is what we need to create awareness. I'm glad earlier when I started my practice, 80% of them used to come in advanced stages. Now I'm glad to tell you that at least 2/3 of the patients, 60 to 70% of them are coming early, and then we are able to cure cancer patients. So that is what we need to understand. And the myth that the cancer is not curable is what we need to move it away. That is the reason why we are gathering here today, and we are launching a survivor's achievement, what you call it as a victory bell today. And without much ado, I would welcome you all once again and request Dr. Bandari to a few words about the awareness.
The topic they've given me is about cancer awareness, prevention, early diagnosis. See, cancer has got two pillars. One is prevention, and the second is early diagnosis. So if we are to strive towards Cancer Mukt Bharat, we should concentrate on these two things. Cancer prevention, for example, if a person is a smoker, we tell them cut down smoking, stop smoking, eliminate smoking from society. Pollution, yes, over a period of time it will get stopped and it will reduce. Second thing, oral cancer, gutka consumption. Government is already doing a lot of legislations, further legislations, and completely stop gutka. It's a difficult thing, but completely stop gutka. These are the two common things which can prevent cancer, lung cancer and oral cancer, which are very common in our country. For example, in women, cervical cancer. There is a vaccine which prevents HPV. The patients, most of them are dependent upon that vaccine. I mean, cancers, cervical cancers due to HPV. So if the girl child takes that vaccine at an early age, that cancer can be prevented. Now coming to the more important topic is, can the cancer be reduced or the cancer be caught in such an early stage that the cancer is curable, what Dr. Vijayanand was talking about. Majority of the cancers fall into that category. For example, in a breast cancer, if a lump, most probably when a woman sees a lump in the breast when the cancer has developed, it is about 1 centimeter in size. By that time, already 1 million cancer cells are there within that lump. Suppose we catch this cancer by mammography at a stage when it is 1 millimeter in size or 2 millimeters in size, then it is sure to be curable, and with surgery alone or with other treatment, it can be cured. So the moral of the story is, with the prevention strategies, basically like mammography, pap smear examination, prostate specific antigen, the various cancers which are prevalent, those common cancers, if we can catch them early, we will considerably reduce the cancer burden. So the importance today is early detection. Thank you.
To be given a topic of utmost importance to know about the warning signs of cancer. See, if anything deadlier is going in our body speaks in its own language. These are the red flags, the warning signs which our body speaks to us. If we understand these warning signs, this help us to pick these cancers early. So to enumerate these warning signs, the first one is if you find any ulcer or a wound in your body or in your mouth which does not heal for more than 3 weeks, it warrants further evaluation to rule out any presence of cancer in it. The same way, if there is any persistent indigestion or difficulty in swallowing, then also you need to approach your doctor to know the cause of this persistent indigestion or difficulty in swallowing. And if there are any changes in your bowel or bladder habits, if there is an increase or decrease in frequency of bowel movements or bladder movements, or if you notice any blood in your stool or urine, then also you need to go for further investigation to rule out what actually is happening in your body. And if there is any unexpected or unusual bleeding in your body, it may be bleeding in your urine or stools, or if there is any contusions following any minimal trauma or no trauma, or there are any unexpected discharge in your body from nipples or any foul discharge from vagina. These are also signs which you need to approach your doctor for further evaluation. Likely, if you observe any new moles in your body or any changes in the existing moles or warts, then also it requires further evaluation. Similarly, if there are any lumps in your body or in your breast, regular self-examination and being aware of the changes in your body will warrant for further detection and early detection of these lumps. So, presence of these signs does not necessarily point towards cancer, but it is always better to be safe than sorry. Consult your doctor, get their opinions, rule out whether it's cancer or not, because early detection makes a hell lot of the difference in us leading a healthy and fulfilling life. And early detection is the key to cure cancer. Thank you.
Oncologist to say a few words.
Yeah. World Cancer Day, the important message is that together we all can beat cancer and make it curable. So that is the message actually by the WHO on the occasion of the World Cancer Day. Now, cancer, when we were young, we used to say that 45% cancers are curable, but now we can say confidently that 75% of cancers are curable. How is it possible? It's because of the improvements in all the treatment methods, whether it is surgery, which can remove the lump totally, or radiotherapy, which can eradicate the tumor totally, or chemotherapy, and all the latest developments in medical oncology like marrow transplantation, like CAR T cell therapy and all. All of them are available in our Apollo hospitals, including the CAR T cell therapy which is coming now. And we are making most cancers curable except the very advanced ones. So the important message is that we should catch it early. We should tell people that all the facilities are available and that we should go in time to the doctors to get the cancer curable. Thank you.
About malignancy and cancer and not to shy away, their important warning signs from our treating angels. Now let's move ahead and take it a step ahead and call our frontline winners, our survivors, our champions who would say a few words.
Good morning, everyone. I'll not take much of your time. Few months back, when my 9-year-old son was diagnosed with a brain tumor, our lives turned upside down. It was like a horrible dream for us. The initial thought got in my mind was cancer is incurable. But the fact is, it is curable. Yes, it is just a myth that cancer is not curable. Because of the advanced treatments and the right selection of the doctors and early detection, the cancer can be cured completely. And much of this, a strong willpower, a positive mindset is the base, and it plays a vital role in the process of defeating this disease. We should never lose hope, and a healthy lifestyle also contributes a lot in defeating this disease. Lastly, I would like to thank Dr. Vijayanand sir, Dr. Shravanti, Dr. Anju, Dr. Divya, Anil sir, and all the technicians and staff members who were very cooperative and friendly with my son. It was like a second home for him. He never felt like it was a treatment going on in the hospital. And lastly, I would like to conclude with be positive, be strong, and never give up. Thank you.
Here we have another champion.
I'm Vagdevi. Good morning, ma'am. Good morning, sir. I was 18 years old when I was diagnosed by medulloblastima, brain tumor. It is 4.5 years till now. Now I'm completely fine, completely doing well like everybody else. The reason behind me being here today like this is Dr. Vijayanand Reddy sir and his team. Sir, my love and gratitude for you is ineffable. Thank you so much. I thank Apollo for bringing sir to Apollo. I thank Apollo too. Thank you so much.
Very happy to see you. It's all the best to you. Congratulations.
Then another survivor who is going to say a few words.
Good afternoon, everyone. I am Ali Muhammad. I say few lines about health. Health is a complete physically, mental, and social well-being, but not the absence of diseases. It is important that we take our body, but not the physical fit and social well-being and cleanliness. I thank to Dr. Vijayanand Reddy for inviting on these auspicious occasions. Thank you. Care, beat cancer and live life. Thank you, Dr. Vijayanand Reddy.
Wonderful survivors. Thank you for these inspiring words. I'm sure the rest of our patients are observing and listening to you. Moving ahead, may I now request Ms. Sangeeta Reddy Madam Garu, our Joint Managing Director, Apollo Cancer Hospital, to address this meeting.
Our dear doctors, members of the press, and most importantly, our cancer survivors and your families, your relatives, your friends, everybody who helped you on the journey. Let me begin by congratulating all of you for this tremendous success that you have had and the strength, the courage, and the conviction that you have had. The most important thing for all of us, you've heard our doctors talk about prevent cancer. If you have cancer, find it early. And then there are all the modalities available to help you cure cancer. So please remember, the most important thing for society as a whole is to remember that cancer is curable. And a person who has won the battle against cancer is as normal as everybody else. So we saw this lovely young girl who told us her story 4 years ago, and this young boy, they're completely normal. So let people not have fear of even saying that they had cancer. And that we have a lovely video message which we will be sharing with all of you. Please share it on your social media so that people who have had cancer know that they can go back into society and feel completely normal. The second important message I'd really like to share with all of you is that, and I'm saying this one specially because we have our Honorable IT Minister here, that the current data which is available is allowing us to use that data and artificial intelligence to move the treatment modalities. రోజుకి డేటా ఎక్విప్మెంట్ మంచి డాక్టర్లు అందరు కలిసి వాళ్ళ ద్వారా ప్రిసిషన్ ఆంకాలజీ ట్రీట్మెంట్ is the latest advancement which we can give, because the medicine that works for one person may not be the best medicine for the next. This precision oncology is the way that we are ensuring that we have the best outcomes in cancer treatment. While we are here at Apollo to give you the best doctors, the best care, the best equipment, the best technology, we are here to celebrate the spirit that every single one of you have to fight, to bring, to support your families, and to ensure that this treatment that we are giving has the best result because of your spirit. So congratulations to all our patients, those who are here and many, many, many others across the country and across the world. We love you. We will continue to strive for you, to give you the best and to ensure that you and your families are healthy. And as our chairman says, with health comes happiness. So wishing you all health and happiness and the will and the spirit to conquer cancer. All the best, and thank you, doctors. Namaste to everyone.
In terms of innovations and keeping Apollo in the forefront. Moving ahead, may I now request Sridhar Babu Garu, Minister of IT and Industries, Telangana State, to say a few words.
ఈరోజు మేము సర్వైవ్ అయినాం. క్యాన్సర్తో బాధపడతా ఉన్న అందరికీ కూడా మేము ఒక ఉదాహరణని ముందుకొచ్చిన సర్వైవర్ ఫ్యామిలీస్కి, సర్వైవర్స్కి ప్రధానంగా ఈరోజు ఈ అపోలో హాస్పిటల్స్ సంబంధించిన సంగీతారెడ్డి గారు, ఈరోజు ఈ కార్యక్రమానికి పిలిచిన డాక్టర్ విజయానంద్ రెడ్డి గారికి, సుబ్రహ్మణ్యం గారికి, అదేవిధంగా బండారి గారికి, సుబ్బారావు గారికి, ప్రసాద్ గారికి, చేతన్ గారికి, చాణక్య గారికి, వివిధ ఆంకాలజిస్ట్కి, ఈ ఆంకాలజీ సెంటర్స్లో పనిచేస్తూ ఉన్న, వివిధ స్థాయిలో పనిచేస్తూ ఉన్న టెక్నీషియన్స్ కానీ ఇతర సిబ్బందికి అందరికీ కూడా ఈరోజు వరల్డ్ క్యాన్సర్ డే సందర్భంలో శుభాకాంక్షలు తెలియజేస్తూ ఉన్నాం. సో ఫస్ట్ ఆఫ్ ఆల్, యాజ్ రైట్లీ సెడ్ బై సంగీత గారు, వీ వుడ్ లైక్ టు కంగ్రాచులేట్ నాట్ ఓన్లీ సర్వైవర్స్, the survivors' family who are behind them, to give them the hope, all the strength, and all the hard work they have done. Congratulations to all the survivors in the family. And coming back, I really appreciate the beautiful moment of the victory bell. This occasion is called victory bell. So you are into the second life, surviving a cancer and entering into a second life. So we have conquered the nature. So that is a victory. The victory bell, I think, symbolizes the ushering era of hope, courage, and strength. And this is the message of this victory bell, it seems, and very good initiative by Dr. Vijayanand Reddy Garu, Sangeeta Reddy Gariki, and the Apollo institution as such, because these sort of occasions will create hope. You know, any individual who takes any profession or who would like to see any dream always enters into the first step on the note of hope. The hope only will define the horizons of our life. So when it's sometimes the message of Apollo Hospital, right, and Dr. Vijayanand Reddy Garu and his team, and which is symbolizing the victory bell. You know, this is what I was just talking to Sangeeta Garu, that you have to give a message as a doctors. You know, on the political side or on the governance side, we have to give the confidence to the people who are suffering from cancer, that cancer can be conquerable, provided it is detected early. So this message has to go a long way. What I'm saying is, I keep visiting so many hospitals. I visited your hospital so many a time as a legislator, as a minister, you know, giving them the confidence that I have to talk to a doctor, even though a doctor takes care with utmost care. What the patients and patient family think is whenever a VIP has to come and attend, then the doctors keep attending. So that is, you know, basically their confidence. So we come here to boost their confidence rather than troubling the doctor. So this is the stage what I see is when I hear any time, even from our own relatives, or the good friend families, or for my near and dear ones, or with my neighbors. When we hear the word cancer, we don't immediately think of first stage or second stage. Oh, cancer! We get panicked. It is too panicky to hear the word cancer and the cancer patients, and the families suffer a lot of mental agony. So this has to overcome. How do we overcome? So we have to create a positive environment back at home, at the same time in the hospitals, what you people are trying to create. And a great step taken by Apollo institutions too, creating confidence, creating hope, building their strength, and telling them we are there for you, for all those cancer patients and to the families. Families as such are the pivotal among the families who, you know, their kids and kin. That's now I was speaking one sister talking about her son. You know, first of all, the mother has to be too strong. The father has to be too strong, or the brother has to be too strong, or somebody in the family should be too strong. If they are too weak, then the patient also feels the same. At the same time, coming back to hospital, just now the other patient, family was just telling, you know, how the doctors over here have given confidence and let them feel it's their second home. That's more important. That's more important. Anyway, you know, doctor we consider is next to God, who can literally make people survive. So this is a beautiful, initiative by Apollo institutions as such, who got a greatest reputation in terms of giving best medical health care, not only domestically but also at the global level. Because I was recently on the international forum, somebody was speaking about Apollo Hospital. We felt proud because this is our institution, this is the institution of Telangana. We told that is also one of the jewel among the healthcare sectors in Telangana. And rightly said by Sangeeta Garu, now the use of technologies among the doctors in terms of healthcare is most important. And the emerging and disrupting technologies and how we can really synchronize with the medical care has to be, I think Apollo institution has already taken the initiative, the use of artificial intelligence, how artificial intelligence will help people, will help doctors primarily, and will help the patients on the other side too. how to literally, early diagnose and how to prevent it. And I've seen a couple of demos how artificial intelligence and the new emerging technologies will help in bringing the best technological revolution in terms of healthcare. And with these few words, I would like to give the congratulations to all the doctors here who are doing the best, level, and give them the best medical care to all the patients who are suffering from cancer. And with these few words, I once again congratulate the survivors and their families and all the doctors who are, there with them. I thank you with these few words. Thank you.
Thank you. Thank you so much. Anybody would like to come, please come. Please join us. Go, Kaku, go. Please go. All of you go. Guys.